Good day, everyone. I'm Mr. Hermar Casio Severino, the Adolescent Health and Development Program Manager of Eastern Visayas Center for Health Development, and I am about to present to you some salient points of the program. So, here are our agenda for our discussion for today. First is the Adolescent Health and Development Program situation in Eastern Visayas, its policy, the number of adolescent friendly health facility, and the Ahdp reporting tool. For our first agenda, the Ahdp situation in Eastern Visayas. So let us focus on this slide. So this is our 3-year data comparison for the Adolescent Health and Development Program. Kung ating mapapansin po, there is only two data available, which is coming from the FHSIS, yung adolescent pregnancy and the adolescent deliveries. We are not saying na ito lang po yung issues ng ating adolescent, but this is the only available data na mayroon po tayo. So, yon. So, kung makikita po natin on the graph, on the year 2020, there is an increase both for the year ages 10 to 14 and 15 to 19 years old, both for pregnancy and deliveries among our adolescent ages 10 to 19 years old. Ang pinagtataka lang po natin, bakit po nag-increase ng teenage pregnancy and deliveries kung during this time is limited po yung paglabas ng ating mga bata? Is it because yung mga bata po ba ay already nag-asawa na? Or is it because yung mga bata po ba, yung mga perpetrator nito ay kasama nila sa bahay? Or is it because yung mga bata po ba ay victims ng violence against women and their children? Yon. Mapapansin din po natin on the report that on the year 2021, nag-decrease po yung teenage pregnancy ang deliveries. Pero what is alarming is yung increase ng 10 to 14 years old both for pregnancies and deliveries. Meaning to say, on the year 2021, pabata na po ang nabubuntis, pabata na po yung nanganganak dito sa Eastern Visayas. Is it because that there is less education or health education na nakukuha ng ating mga bata in terms of adolescent sexual reproductive health? Or is it because maraming mga bata yung hindi nare-reach ng ating mga health workers for the promotion of reproductive health on their ages? So that is basically the Adolescent Health and Development Program in Eastern Visayas by numbers. So now we are to present to you the AHDP policies that we think that would help us address these issues or adolescent issues in terms of pregnancies and deliveries in Eastern Visayas. One reasons why our adolescents are not acquiring health services is that they don't know that the facility or the rural health units are providing health services for ages 10 to 19 years old. And second, they are scared with the service providers that they will be judged because majority of the health providers that they have encountered are actually judgmental. So that is why the Department of Health created a Department Memorandum number 2017-0098, which is subject of Adolescent Friendly Health Facility Standard Evaluation Tool. This aims to make our facility adolescent friendly, to invite our adolescent to freely go to our facility in order for them to share what they feel and what they thought, and then to acquire services in an adolescent friendly environment. Basically, we do have 3 levels of adolescent-friendly health facility. But for now, we will be focusing on the level 1 criteria. So ano-ano po yung mga level 1 criteria to make your facility adolescent-friendly? We just need a welcome signage, we just need a clinic hours or schedule, services provided, the clinical guidelines, registration logbook, services provided, listed, a designated person, and a designated room or space. One reason why our adolescents are not going to our facility is that they don't know that your facility is an adolescent friendly. In order for them to know that your facility is adolescent friendly, kailangan po natin ng welcome signage. And this is an example of a welcome signage of a certain facility in Eastern Visayas. So it says here, welcome to Adolescent Friendly Health Facility. By merely posting this one outside and inside your facility, it can actually provide an information to our adolescent that you are welcome, they are welcome, and you are an adolescent friendly facility. Next is the postage of our schedule of clinic hours and list of services. Ito po ay isa sa mga sample ng ating um, welcome tarpaulin or welcome signage kung saan ang schedule of clinic hours and services ay nakapost na rin po. Mas maganda po ito na nakapost sa labas at sa loob ng ating facility para madaling malaman ng ating adolescent kung ano ang mga serbisyong ino-offer ng ating facility at kung tagawen po, ito pwedeng puntahan ng ating adolescent para sila ay mag-avail ng services. One indication that your facility is adolescent-friendly is kung maraming pumupunta na adolescent sa inyong facility. Paano po natin malalaman kung maraming pumupunta sa inyong facility is through a registration logbook. This is an example of a registration logbook in one of the Level 3 adolescent-friendly health facility in the region. In order for us to ensure that we are in compliance to the DOH standard, we need Ahdp clinical guidelines. So this includes our Manual of Operation, ADJA Manual, and the Administrative Order number 2013-0013. For now, we have already allocated the MOP and ADJA Manual to the different local government units and rural health units in the region. We also need to have a designated point person kung saan siya po yung magiging point person ng ating programa. Siya rin po yung mag-handle ng mga data or mga pertinent documents regarding sa adolescent because we ensure that our adolescents' data will be kept confidential and private. Meaning to say, hindi po basta-basta nakukuha yung adolescent data ng kung sino-sino lamang. We also want to have an alternate of this designated person in the event na yung person po is not available. Baka may training or di kaya nagpunta sa laing ang health facility for other purposes para hindi po ma-stop yung ating services sa ating programa. Next is a designated room. We are not telling that all facility needs to construct a new room or a new building but a designated room lamang po. We know na busy po tayo sa ating rural health unit. We are just asking for a schedule for our adolescent health and development program and then also a designated room kung saan doon po ikakandak ang ating counseling, ating serbisyo to observe privacy and confidentiality for our adolescent clients. This is actually included na sa ating level 2 adolescent-friendly health facility checklist. But as early as level 1, we encourage the rural health units and health facilities to have their AHTP policies. Kasi mas maganda na level 1 pa lang alam na po natin kung anong mga pulisiya ang dapat i-observe ng ating health service providers within our health facility. And these health policies or adolescent health development program policies could be actually simplified and posted para mas madaling mabasa ng ating mga health workers at the same time yung mga clients natin na adolescent. For example, for this policy is this one. This facility observes privacy and confidentiality. By posting this one, madaling mababasa ng ating adolescent na yung iyong health facility ay nag-o-observe ng privacy and confidentiality kung saan ang kanilang ibibigay na impormasyon sa kanila ay hindi basta-basta malalaman ng kahit na sino unless it can harm them or it can help them. So that is basically the standards of the Adolescent Health and Development Program for the Adolescent Friendly Health Facility. Kung saan, bago po ito nagawa ay nagkaroon po muna ng technical working group, yung mga sectoral groups doon sa central office kasama yung mga adolescent. These are actually the suggestions coming from those age group 10 to 19 years old para mapatunayan nila that these are actually in accordance with the standard at the same time to the standards of the adolescents. So you may ask, ilan na po ba yung mga adolescent-friendly health facility in the region? So as of June 2022, ito na po yung mga number of health facilities na mayroong adolescent-friendly health facility. So yung sinicertify lang po natin or recognize lang po natin here in the Center for Health Development sa Region 8 are those endorsed by the provincial or city health office to us. Maybe there are adolescent-friendly health facility in this local government unit but are not yet endorsed to the Center for Health Development. So for now, only Leyte, Southern Leyte, Samar, and Tacloban City has as endorsed adolescent-friendly health facility in the Eastern Visayas. So here are the list of the endorsed adolescent-friendly health facility to the Center for Health Development, Eastern Visayas. So we have two health facilities. Both are hospitals that are actually certified as adolescent-friendly health facility level 3 by central office last uh, 2019. Actually, they are one of the few level 3 in the whole Philippines. These are Eastern Visayas Medical Center and Aboyog District Hospital. Also, we have some RHUs, majority are from Leyte, who are certified as adolescent-friendly health facility level 1, recognized last 2019. We also have some hospitals in Leyte that are certified as level 1 adolescent-friendly health facility. Also, one hospital in Samar and some rural health units in Samar and Southern Leyte that are actually certified last 2019 as adolescent-friendly health facility level 1. As we have said earlier, nakulang po tayo ng datos sa Adolescent Health and Development. Yung source of data lang po natin for the Adolescent Health and Development is the FHSIS. Unfortunately, ang FHSIS ay napro-provide lamang po ng datos sa teenage pregnancy and teenage delivery. So that is why through the assistance coming from the central office, we created a Ahdp reporting tool wherein doon po natin titingnan yung majority of our adolescent issues na makukuha natin sa ating record book or record book na rini-require ng ating adolescent-friendly health facility. Before we proceed sa ating HTP reporting tool, let us see muna yung frequency of reporting. Ideally, our reports are coming from the barangay to the BHS, and then the BHS to the RHUs, and then the RHU will consolidate all their data, and then will submit to the provincial city health office monthly or quarterly. And then, the provincial city health office will submit to the Center for Health Development quarterly, and then kami po dito sa Center for Health Development will submit our data semi-annual or annual. This is our simplified AHTP reporting tool. So, ang gagawin lang po natin kung ilan po yung mga adolescent na pumunta doon na may mga ganitong issues, yun lang po ang i-report. That's the passive reporting. But we can do the active reporting kung saan in every barangay, magkakaroon po tayo ng house-to-house data collection. We can do both active and passive reporting po. And this is monthly on the level of our RHUs. So if you want to have the soft copy on this one, just ask lang po our facilitators and we can actually give you the soft copy po. I know you will ask, sir, hindi pa po kami trained sa Adolescent Health and Development. Or di kaya, sir, meron po kaming trained. Kaso lang, 10 years ago pa po. Ano po yung pwede natin gawin? So we can do refreshers training or training po. One direction of the Department of Health is to make our trainings available na po sa lahat ng service providers. So yun. So that is why Department of Health created this Department of Health Academy or DOH Academy. What we need lang po is to have an internet connection and then log in lang po dito sa website na ito. So once na mayroon na po tayong account sa DOH Academy, and then in order for us to make ourselves adolescent-friendly service provider in an adolescent-friendly health facility, just look for the Ahdp training. So yon, ito po ay isa sa mga trainings na ginawa ni DOH Academy. Yun po. This is equivalent to the ADJA training na 5 days, but you can actually do this in 10 hours setting. So, pwede po siyang self-paced, pwede po siyang tuloy-tuloy. So, ang kagandahan lang po ni Ahdp is that self-paced siya. So, kung when lang tayo may available time, pwede natin siyang tapusin.
And then, mayroon po siyang tinatawag na CPD units. For those service providers na need ng CPD units, Ahdp can provide you the CPD units that you will be needing. You just need an internet connection and an access or username sa DOH Academy. So, yon. So, yung CPD units niya po is accredited from February 22, 2022 to February 21, 2023. So, yon. So, for the physicians, we have 6 CPD units. For the medical technologists, we have 1 CPD units. For the nurse, we have 9.5 CPD units. For the pharmacist, we have 8.5 CPD units. And for the midwife and dentist, we have 5 CPD units each. I think that would be all for my presentation for the salient points of the adolescent health and development. So if you have some questions, you can actually raise that to our facilitators in order for us to address that in the near future. And then also we encourage each and everyone to access our trainings in the DOH Academy, especially the ADEP training po, in order for us to make ourselves adolescent friendly. I think that would be all. Thank you so much. And towards an adolescent friendly region, we can help each other, and then sama-sama po tayo on this advocacy for our adolescent. Maraming maraming salamat, and until next time.